So first of all, we will see what is health. Health is nothing but the state of complete physical, mental and social well-being. The state of holistic physical, mental and social well-being is called as health. The condition in which our physical, mental and social status is well, it is in good condition, then it is to be called as a healthy person. A person who is physically fit, mentally fit and socially fit, then it is a healthy person. Then we will see about disease. Okay. See, healthy person means without disease. But it's not possible to be healthy each and every time. Sometimes due to certain conditions such as due to bacteria, due to viruses, some diseases are caused to human being. So we will learn what is disease. Here, when physiological and psychological processes in the body are disturbed, then it is said to be the condition of disease. When physiological and psychological processes in the body are disturbed, then it is said to be the condition of disease. As per the disease, symptoms are varied. According to disease, the symptoms varies. Means different diseases cause different types of symptoms. Now, we will learn there are various types of diseases. There are different types of diseases. They can be classified generally as follows. See, there are various types of diseases in this world. The diseases varies according to duration, according to vector, according to causing symptoms. Let us see what are the classification of diseases. So according to duration, there are two types of diseases, chronic disease and acute disease. According to duration, there are two types of disease, chronic disease and acute disease. See, the disease which takes longer duration to be cured. The disease which takes longer duration to be cured, it is called as chronic disease. These chronic diseases are taking longer duration. They are more dangerous as compared to the acute disease. Sometimes death of the person may be happen in case of chronic disease. Okay, the chronic disease may lead to the death also. Example of chronic diseases are cancer, arthritis, etc. Okay, cancer. This is cancer. Suppose the cancer is there, then this type of cancer, it causes a long duration to be cured. And the treatment of cancer is also not very simple. It takes a longer duration. Same is the case of arthritis also. Arthritis also takes longer duration to be cured. So these are the chronic diseases which may be cured, but they take longer duration, or sometimes the chronic diseases are, it is not possible to cure these chronic diseases in sometimes. Now we will see what are the acute diseases. Acute diseases means the disease which takes smaller duration as compared to the chronic diseases. These acute diseases takes smaller duration to be cured. Acute disease is cured easily. Sometimes without medicines also these acute diseases are cured. Examples are fever that comes suddenly, or cold. You know that sometimes due to the change in climate we fall sick, but without taking medicines also we are cured. Same is the case of cold. Sometimes we take medicines or sometimes we do not take, and without taking medicines also within 2 or 3 days or within a week we are cured completely. So these types of diseases are called as acute diseases. Then according to causes, there are different types of diseases. First one is hereditary diseases. Hereditary diseases, as the name indicates, these diseases are caused through the heredity. From the parents, from the grandparents, we are getting these diseases through heredity. So these diseases are called as hereditary diseases. Example is Down syndrome, hemophilia. These are the examples of these diseases. Then there is another type, it is called as acquired disease. Another type is called as acquired disease. There are again two types in this acquired disease: communicable or infectious disease and non-communicable or non-infectious disease. First one is communicable, the disease which are infectious, the disease which get infected from one person to another person. Okay, these diseases are infected from one person to another person. These type of diseases are called as communicable or infectious disease. Example, cold and dengue. Cold and dengue. If you take the example of cold, if a person is infected by cold, then the nearby person may also get affected because it is an infectious disease. Another one is dengue. Dengue, it is caused by mosquitoes. It is caused through mosquitoes, so it is also an infectious disease. Then non-communicable or non-infectious disease. Here examples are diabetes, heart disorders, heart attack, etc. So diabetes हो गया, heart attack, all these diseases are non-infectious. Means one person is having diabetes, and nearby person sitting to that person can't get diabetes because it is a non-infectious disease. Then we will see communicable or infectious diseases in detail. Let us see agents such as contaminated air. Agents such as contaminated air. If the air is contaminated, for example, if we are sitting in a class, and a person is having infected by COVID-19 virus, then what will happen? If all the students in that class are not wearing masks, then what will happen? All the students may get infected by that disease. So this type of disease are called as infectious disease. So agents such as contaminated air, water, food, or vectors, insects and other animals spread certain diseases which are known as communicable or infectious disease. So these communicable or infectious diseases are spread through air, through water, through food, or through vectors such as insects and other animals, such as mosquitoes. Through mosquitoes, malaria and dengue are spread through mosquitoes. Okay, certain diseases such as COVID-19 virus, they are spread through air. Some diseases such as cholera, etc., they are spread through water. Food poisoning, this disease is spread through food. So through these agents, communicable or infectious diseases are spread. Then we will see again about some important infectious disease, in which hepatitis, dysentery, tuberculosis, cholera, typhoid. About these diseases we will learn. Let us see about hepatitis. So, in case of hepatitis, causative organisms or pathogens are viruses of hepatitis. These viruses are of 5 types: virus A, B, C, D, and E. Through these viruses, hepatitis is caused to a person. A person is infected through these pathogens by hepatitis. Then, mode of infection. What is the mode of infection in case of hepatitis? The mode of infection is contaminated water, sharing of needles, transfusion of infection, carrying blood, means infected blood, contaminated water, sharing of needles, and infected blood. These are the causes or mode of infection in case of hepatitis. Then what are the symptoms? Here, anorexia means no appetite for food. There is no appetite for food in case of hepatitis. Then urine is dark colored, general weakness is there, nausea, vomiting, grey colored stool. These are the symptoms for hepatitis. So hepatitis is a viral disease. It is a viral disease. Then another disease we will see, which is viral and bacterial also. Diarrhea and dysentery. Diarrhea and dysentery. These diseases are caused through bacteria, virus, that is Shigella, Bacilli, Entamoeba, Histolica, etc. Mode of infection in case of diarrhea and dysentery is contaminated food and water. Symptoms are watery stool, abdominal pain, etc. Then let us see bacterial diseases. In case of bacterial disease, we will see the tuberculosis. Tuberculosis, in case of tuberculosis, the causative organism is Mycobacterium tuberculei. What happens here? The mode of infection is patient spittle through air, continuous contact with patient using the things of patient. These are the causative causes or mode of infection. The symptoms in case of tuberculosis is chronic cough, blood spitting, emaciation, difficult breathing. All these are the symptoms of tuberculosis. Then in case of cholera, causative organism is Vibrio cholerae. Mode of infection is contaminated food and water. Symptoms are vomiting, severe diarrhea, cramps in legs. And in case of typhoid, causative organism is Salmonella typhi. Mode of infection is contaminated food and water. Symptoms are anorexia, headache, rash on the abdomen, loose motion, high fever which reaches up to 104 degree Fahrenheit. So in case of typhoid, high fever goes up to 104 degree Fahrenheit, headache is there, rash is seen on abdomen, loose motions are there, anorexia is there. Mode of infection is contaminated food and water, and causative organism is Salmonella typhi. It is a causative organism or pathogen in case of typhoid. Now we will see some another important diseases like dengue, swine flu and AIDS. Let us see. In case of dengue, the transmission occurs through Aedes aegypti. It is a mosquito which spreads infectious disease called as dengue. Aedes aegypti is a mosquito which spreads infectious disease called as dengue. What happens here? The sickness spreads by DEN1, 2 virus belonging to the type flavivirus. And what are the symptoms in case of dengue? Acute and severe fever is there, severe headache, vomiting, pain in the eye sockets, decrease in the count of blood platelets, internal hemorrhage in the body. These are the symptoms in case of dengue. What are the symptoms? Acute and severe fever, severe headache, vomiting, pain in the eye sockets, decrease in the count of blood platelets, internal hemorrhage in the body. Then let us see about swine flu. In case of swine flu, the infection of swine flu is transmitted through pigs or infected humans. Swine flu is transmitted through pigs or infected humans. Then the virus influenza H1N1 causes the infection of swine flu. Spread of the disease is through sweat, secretion of nose, throat and saliva. Spread of the disease is through sweat, secretion of nose, throat and saliva. And what are the symptoms in case of swine flu? Palpitations, difficulty in breathing, sore throat and body pains. Then let's learn about AIDS, HIV, human immunodeficiency virus. The mode of transmission in case of AIDS is HIV, human immunodeficiency virus. Now what are the symptoms in case of AIDS? Symptoms are specific to every person. There is progressive weakening of the natural immunity which makes a person susceptible to variety of infections. The unsafe sexual contact and the contaminated blood and blood products causes transmission of HIV. Then we will see infections through animals, that is zoonotic infections. Infections which occurs through animals are called as zoonotic infections. Let us see. First one is rabies. So rabies, it's a fatal disease. It is called zoonotic disease as it spreads through the animals to humans. Okay. The causative organisms are virus infected dog, rabbit, monkey or cat can transmit this disease, that is rabies. The virus through its bite. Okay. If a dog, for example, if infected dog or cat or rabbit or monkey bites a man, then man is suffering from that disease that is called as rabies. Now symptoms of this rabies are seen within 90 to 175 days of animal bite. Within 90 to 175 days of animal bite, the symptoms are seen. What happens here? Virus enters the brain via neurons. This virus of rabies enters through the brain via neurons. Fever is for 2 to 12 days, 2 to 12 weeks. Fever is longer, not for days, it is for weeks. Fever is for 2 to 12 weeks. Exaggeration in behavior is there. Hydrophobia is there. Hydrophobia means fever of water is there. And what is the treatment? Vaccination can be preventive if taken immediately after the bite. That's why you have to take care after the bite of animal. If a dog or cat or monkey, any animal bites you, you have to immediately contact a doctor and take the vaccination for rabies. Okay, if a dog bites you, then you have to immediately take vaccination for rabies. Then we will see non-infectious diseases. Here cancer, diabetes and heart diseases are non-infectious diseases. Let us see non-infectious or non-communicable diseases. The diseases that are not spread through contact or through infections are called as non-infectious or non-communicable diseases. The diseases that are not spread through contact or through infections are called as non-infectious or non-communicable diseases. See here, certain degenerative processes or some metabolic errors can cause such diseases. First of all, we see what is cancer. Cancer is the uncontrolled and abnormal growth of the cells. Cancer is the uncontrolled and abnormal growth of the cells. When there is a loss of control on the cell division, then the cell keeps on dividing and growing. When there is a loss of control on the cell division, then the cells keep on dividing and growing. This makes formation of lump of cancerous cells. This makes formation of lump of cancerous cells. Commonly it is known as tumor. What is tumor? Tumor is nothing but lump of cancerous cells. Any tissue or organ of the body can develop cancer. Any tissue or organ of the body can develop cancer. That organ may be throat, it may be blood, okay, throat cancer, blood cancer, mouth cancer, breast cancer, uterus cancer, cervix cancer. These are all the types of cancer. Let us see. Here examples are lungs, mouth, tongue, breast and uterus and cervix in females. Even the blood or skin can get cancer. So these are all the types of cancer. What are the types of cancer? Lung cancer is there, mouth cancer, tongue cancer, breast cancer, uterus cancer, cervix cancer, blood cancer and skin cancer. Now let us see what are the causes behind cancer. Consumption of carcinogenic substances. That is substances that cause cancer such as tobacco and gutkha. Eating of tobacco and gutkha is harmful to human health because it is a carcinogenic substance which causes cancer. Then let us see another cause. Cigarette smoking and consuming alcohol. Cigarette smoking and consuming alcohol also causes cancer. Then eating junk food such as pizza, burger, etc. and not taking enough fiber content in the form of fruits and leafy vegetables in the food. Eating junk food such as pizza and burger can also cause cancer. If you are eating pizza and burger again and again, okay, once in a month, if you are eating a pizza or burger, then it's okay. But you are eating this type of fast food in majority of time, then it may lead to cancer. Then due to cancer genes, that is due to hereditary reasons. Sometimes from parents also the child may get cancer. Then let us see about diabetes. Another disease is diabetes. In normal persons, there is a secretion of insulin hormone from the pancreas. See, the insulin hormone is secreted from the pancreas inside the human body. The role of insulin is to keep control over the blood glucose level by changing the metabolism accordingly. So what is the role of insulin? The role of insulin is to control blood glucose level by changing the metabolism accordingly. In case of diabetic individuals, the secretion of insulin is either in deficiency or in it is not secreted at all. If there is a person who is diabetic, then in case of diabetic person, this insulin hormone is secreted irregularly, means either it is not secreted or it is secreted in a less quantity, it is secreted in scarcity. In case of diabetic patients, the sugar in the blood is never maintained in its normal amount. In case of diabetic patients, the sugar in the blood is never maintained in normal amount. Now let's see what are the causes of diabetes. The causes of diabetes are hereditary, lack of physical work or exercise, mental stress, anxiety, obesity. These are the causes of diabetes. And what are the symptoms? Symptoms are increased thirst in case of diabetic person. In case of diabetic patient, the thirst is increased. There is increased and frequent urination. Then there is more urge of urination at night. Uncontrolled weight gain or weight loss is there, and feeling of fatigue. These are the symptoms for diabetes. And what are the preventive measures or control over diabetes? First one is proper diet. You have to take proper diet. Then control over consumption of carbohydrates and fats. Consumption of carbohydrates and fats is to be controlled. Then taking proper medicines and treatment as per the doctor's advice. As per the doctor's advice, you have to take proper medicines and treatment. Physical exercise and regular walking. Physical exercise and regular walking is must in case of prevention of diabetes. Then diagnosis. How the diabetes is diagnosed? For that we have to test the blood sugar level, and HbA1c test is also there. How we have to treat this diabetes? The treatment for diabetes is injection of insulin or tablets that will stimulate the secretion of insulin. Okay, in case of diabetes, you have to take injection of insulins or tablets, and then complete control over diet should be there. This is the treatment for the diabetes. Then let us see about heart diseases. When the efficiency of the heart is reduced due to some causes, the heart does not perform its regular work. This causes heart disease. Due to certain reasons, when the heart does not perform its regular work, then it is called as heart disease. Continuous supply of blood is needed for the heart muscles. For the heart muscles to work properly, continuous supply of blood is needed. This blood provides oxygen and nutrients to the heart. This blood provides oxygen and nutrients to the heart. When this supply is hindered, means it is affected, the heart gets stressed. This can cause heart attack. When this supply of blood is hindered or it is affected, then the heart gets stressed, and this may cause heart attack. Then what are the causes behind heart attack? First one is smoking and alcoholism, then diabetes, hypertension, obesity or lack of physical work, no exercise or sedentary habits, then hereditary and mental stress, anger, anxiety. These are the causes. Okay, smoking and alcoholism, diabetes. If diabetic person may get heart attack, hypertension. If a person is in hypertension, then he may get heart attack. Obesity is one of the reason. Lack of physical work is one of the reason. Then no exercise, sedentary habits, hereditary, through heredity, when from parents, the child get heart attack situation. Then mental stress, anger, anxiety may cause heart attack. Then what are the symptoms after heart attacks? Chest pain which is severe. Okay, in case of heart attack, severe chest pain is there. This chest pain is not a normal, it is a severe chest pain. Then shoulder, neck and left arm pains. There is shoulder, neck and left arm pain. Why only left arm pain is there? Why not right arm? Because our heart lies at the left arm. That's why shoulder, neck and left arm pains are there. Then cramp in the hand is there, cramp in the hand, excessive perspiration, uneasiness and tremors, urge to defecate or urinate. These are all the symptoms of heart attack. Then what is the first aid for heart disease? Immediately seeking help from 108 for calling ambulance. Okay, first of all you have to call ambulance, then check whether the patient is conscious or not. Giving first aid of cause type, that is compression only life support to the patient. Then in this The patient is made to lie on the hard surface in horizontal position and the pressure is given on his or her thorax so that the heart is kept on working. The pressure and stroking is continued till the doctor arrives. So this is the first aid we have to give till the doctor arrives or till the patient is admitted in the hospital. And then what is the diagnosis for heart attack? First of all, ECG is taken to check the activity of the heart, then complete checkup by the cardiologist, and then few specific blood tests are there. Now what is the treatment over heart attack? First one is angioplasty, then bypass surgery, third one is open heart surgery, then heart transplant, then installation of stents, and last one is installation of pacemaker. These are the treatments for heart attacks: angioplasty, bypass surgery, open heart surgery, heart transplant, installation of stents, and installation of pacemaker. These all are the treatments for heart attack. Then let us see what is misuse of medicines. See, many persons are having the habits of taking medicines by themselves without the consult of doctor. Every time whenever there is need of taking medicine, we have to consult the doctor first. Without consultation of doctor, taking medicine is harmful. So whenever you want to take medicines, you have to consult the doctors. Let's see here. Painkillers when taken in overdose cause damage to nervous system, excretory system and liver, etc. When painkillers are taken in overdose, it causes damage to nervous system, excretory system and liver. Then overuse and unnecessary use of antibiotics. Overuse and unnecessary, when there is not necessity, then in that case also if we are using antibiotics, then it can cause nausea, abdominal pain, loose motion, rashes on the body and white patches on the tongue. So use of antibiotics should be in limited way. It should not be unnecessarily used. Then taking medicines without doctor's prescription and overuse of medicines will certainly cause harmful side effects on the body. Taking medicines without doctor's prescription and overuse of medicines will certainly cause harmful side effects on the body. Then generic medicines. Generic medicines or general medicines are manufactured and distributed without any patent. Means the medicines which are not having any patent, they are called as generic medicines. These medicines are comparatively and cheaper. Okay, these medicines are comparatively much cheaper than the branded medicines. In comparison with the branded medicines, these generic medicines are cheaper. Branded medicines means the company which are branded like Cipla, etc. In that comparison, these generic medicines are cheaper. However, they are equal in their quality and branded medicines with branded medicines. As per branded medicines, they are also equal in quality. Then generic medicines are exported. Okay, generic medicines are exported on a large scale by Indian companies. But in India, the same medicines are sold as branded medicines by increasing their price. In America, 80% of medicines are used are generic, and hence they save billions of dollars. Hence they are saving billions of dollars. Billions of dollars they are saving. In America, the people are saving billions of dollars because they are using generic medicines. 80% of people are using generic medicines. Hence they are saving billions of dollars. But in India, we are going after buying a branded medicines. We are buying branded medicines, which is not cheaper. Now, under Pradhan Mantri Jan Aushadhi Yojana, best quality medicines are made available at affordable prices to the common people. These medicines are available in Jan Aushadhi stores. This scheme was started by Government of India on 1st July 2015. From 1st July 2015, this scheme is started. And let's see what are the lifestyle and diseases. Lifestyle is type of diet, the routine and the pattern of thinking too. Right kind of lifestyle includes sufficient sleep. Sleep must be sufficient. Okay. Sleep early and rise early. Right food, yoga, pranayam and sufficient physical exercise. Then by wrong kind of lifestyle there is increased frequency of ill health and episodes of diseases. And at last we have to see about vaccination. See, vaccination is very necessary for prevention of infectious diseases. Preventive vaccination can be given. This saves the health of person. By vaccination, babies can be protected against many diseases like Covishield. Covishield is a vaccine against COVID-19 virus. So each and every person should get that vaccine. Now the peoples above 18 years are getting Covishield vaccine against coronavirus. So this is all about health and diseases.